Tell us a bit about your work. What do you do?
What we do as Mvula Trust, we work with rural women, training them in health and hygiene practices, because we believe that sanitation actually slows the progression of disease. It breaks down the cycle of disease completely. So we teach them in key health messages, one being personal hygiene, whereby we teach people to wash hands every time after using the toilet, but also the proper use of the toilet, which is to ensure that you use the seat, use the pit, inside the toilet. You are not going to go outside the toilet and mess around the toilet. You close the seat after using the toilet. You close the door of the toilet after using the toilet.
And do you think people understand about hygiene? When you move around these towns, do you think people have a sense of hygiene?
Completely, because the way we work with communities is that we actually tap into their own knowledge as the Mvula Trust. We use what we call community-based approach, which looks at how people themselves drive these initiatives. People might not have resources on how to fight sanitation, but they know what is the right thing to do and what is the wrong thing to do. Therefore, provision of toilets only aids them in ensuring that health practices are taken forward.
Now, people are indeed benefiting, isn't it? Are you finding that people are more happier now that they have these sanitation facilities?
Not only are they happier, but they're leading healthier lives, which is far more important. Because with healthier lives, it means people are more productive. They can lead healthier lives, they can work, children can stay in schools and lead far more productive lives. And that's how, in our view, community will start to progress and become more developmental.
Now, one of the beneficiaries, I understand, is this young lady. Can I call you young? You obviously benefited from the toilets, isn't it? How do you feel? Just tell us a bit about your story. What's your name, first of all?
Yes.
Or maybe you can help translate, yeah? Analusha, just tell us where you're from and what has been your experience in terms of sanitation?
Sanitation,
itoilet endiyifumene mna endiyiphathelwe nguMvula Trust inhle kakhulu, ndiyayithanda. Enye into bendikade ndingena toilet, bendihamba ndiyotshona le emadwaleni ndingananda uyokusithela, kodwa uthe uba fika uMvula Trust wandifakela itoilet enhle, ndaqonda uba yeyi undincedile, kaloku bendikade ndizisokolela mna.
What she's saying is that she likes the toilet the Mvula Trust has provided, because in the past you used to walk long distances to go relieve yourself, but now the sanitation facility is nearby, which really aids her. It helps her a lot. She doesn't have to walk those long distances, and she can relieve herself right at home.
Is that a common thing, Virginia, when you walk around and do your training? Do you find that that's a common place here?
Yeah. I mean, it's something that people from urban areas, it's easy for us to take for granted. We have flush toilets, for example. But in rural areas, that is a rare find. That is why Mvula Trust is working with municipalities, supporting them in the rollout of these VIP toilets. Because without that, for women in particular, the risks are many. Not only, like Mama is saying, they walk long distances. You can imagine that is an unsafe environment for her physically. Anything could happen to her while she's making those distances. So actually, for Mvula Trust and the municipalities to provide these facilities, they're taking care of a lot of problems that could befall women. The risk is not only to them physically, but to their health as well. Because if you're not doing those key messages that I spoke about, washing your hands, chances are you're going to fall ill. And you can have the rest of the village being on diarrhea and so on. It gets worse with the HIV and AIDS pandemic, for example. If we do not have sterile environments, it gets very dangerous for people living with the disease. So we have to ensure that the environment is clean, the water is sterile enough, and it also makes the tasks of these women, who are often the caretakers, the caregivers at home, their work a lot easier if they have sanitation facilities nearby, if they have water facilities nearby.
Indeed. That's where we'll have to leave it. Virginia Molose and Mama, thank you very much indeed for your time and all the best in terms of your future. Indeed. indeed it is touching people's lives. As you heard, people who never had a toilet before, now they do, and it's improving their lives. Work continues in the background, making these precast toilets and distributing to the Mount Fletcher residents. It is indeed needed in this very area.